ممكن يتفضل الدكتور مازن عبد هزاع، استشاري أمراض القلب والتداخل القسطاري، لتقديم هذه الحالة النادرة من أمراض القلب والمهمة حقيقة، اللي هي right ventricular dysplasia as a cause of one of the major cardiac disease and arrhythmia. تفضل دكتور مازن.
شكرا أستاذ الفاضل الدكتور محمد العواد والأستاذ كاظم الرباعي، أساتذتي الأفاضل، زملائي زميلاتي الفاضلات، الزملاء الحضور جميعا. I choose this is a very important case that I face in my daily practice, and actually it is very important cases we see a lot in our daily practice, but it is missed, and by this we lose a lot of young patients. This is very young patient, 20-year-old, presented to me with attacks of syncope while he's playing football. He feel when I am playing a football, I feel very severe palpitation that I feel my heart getting out of my chest, okay? And thereafter, he gets syncope, and immediately the patient is referred to a Zubair hospital. ECG was done for him, and DC shock was done for him, and the patient returned back to normal. But unfortunately, his brother died suddenly by the same story during playing football. His brother was 18-year-old, died suddenly while he's playing a football. So the patient, this is the ECG of the patient at the emergency room. We see a wide complex tachycardia, that is ventricular tachycardia, and it is of left bundle branch morphology. And this is very horrible ECG we face in the emergency department. So he consulted a cardiologist at that time. He did for him resting ECG. The resting ECG was totally normal, with normal thyroid function test, normal all cardiac biomarker, including troponin, D-dimer, and brain natriuretic peptide. Echo at that time was totally normal with good LV ejection fraction. And the patient was shifted to a Nasriya cardiac center to deal with such risky arrhythmia, but all re-evaluation was negative. ECG, echo, and even the CMR. CMR was totally normal. And the patient returned back to the home and kept on regular treatment with imiodarone and bisoprolol. But unfortunately, the patient continued to have the same symptoms, attacks of palpitation, followed by syncope, and unfortunately, his sister, 23-year-old, also died suddenly after this attack. So this makes very a tragedy story to the family, and the father for this insists to marry his brother, بس المشكلة زوجة المن زوجة البنت عمه. So what is next? Next, I did for the patient Holter monitoring, and the Holter shows runs of ill-sustained ventricular tachycardia, and the tachycardia was of left bundle branch block morphology, and this raised the suspicion of right-sided problem, that is right ventricular dysplasia. So when I saw him, I did for him echo. الايكو السابق كومبليتلي بالناصريه وبالبصره كان كومبليتلي نورمال. على كل يعني واضح من الصوره انه الرايت سايد اوف ذا هارت, this is the left side of the heart and this is the right side. The right side is hugely dilated, which was at that time was normal. Next. And this is the another picture in طبعا بالبيكتشر اي هسه قبلها يمكن يشتغل خل نرجعه. يلا. Okay. And then the right side was hugely dilated, and there is moderate pulmonary regurgitation. Left side completely normal. And this is the apical view. You see the huge dilatation of the right ventricle, and there is tricuspid regurgitation with an RV pressure of 30 millimeter mercury, mildly elevated RV pressure. Surprising, the echo before 6 or 7 months was normal. Why he get these changes within this period? So the diagnosis of RV dysplasia. why echo was normal and why CMR was normal at that time. Diagnosis of RV dysplasia is definitely done by CMR, cardiac MRI. Why it was normal at this time? Actually, the RV dysplasia started as a small, very small, tiny focus of fibrofatty degeneration, non-ischemic scar tissue in the RVOT that is difficult to be detected by echo or by the cardiac MR. It needs special training and special يعني خبرة في إنه تنلقوا في الظاهر بالناصية they have no good experience to get the diagnosis of RV dysplasia. This fatty fibrosis start to expand progressively to involve big size of the RV. That's why the patient get RV myopathy. For that reason, we did for a patient implantable cardioverter, and by this we prevent sudden death from this young man. And unfortunately, if we face his brother and his sister, we save the life of his family. What is the home message from this case? Number one, any palpitation with syncope, this is a risky manifestation, and this should be dealt with even the investigation was normal. Number two, do not, the diagnosis of RV dysplasia is difficult because it appeared totally normal. And third, implantable cardioverter is available and we can save the life of most of these patients. And thank you for your listening. Shukran.
Thank you, Dr. Mazin, for this presentation. And you can